Well, hey there, everybody. This is Nate Gustafson. I am thrilled to be with you again today. I serve as the volunteer coordinator with Brookdale Hospice in the Denver metro area, and I just enjoy training up and bringing on kind-hearted souls who want to dedicate their valuable time and talent and heart to the work of caring for hospice patients. Today I'm going to be sharing a video training with you that goes into a deeper dive of what it looks like to be a hospice volunteer and looks at the question, what can I offer to others? So I'm so glad you're with us. I look forward to this presentation with you, and I hope that you'll reach out to me with any questions or concerns that you might have, and that this would really be an encouragement and an inspiration to you to get involved and to dive in and give of your heart to these special people. So the philosophy of hospice, just to review, a lot of people think of hospice as a place that people who are dying go to. Maybe they only have a day or two to live, but really what we want to emphasize is the philosophy of hospice, and it really fits in line with the philosophy and the mission of the company I serve with, which is Brookdale. We believe in enriching lives, and that's at the key and the forefront of everything that we do, whether it's hospice, whether it's senior living, whether it's home health, or anything in between. And so in review, hospice is really about providing sensitive and caring support to patients and family members at the end of life's journey. We want to help patients to carry on a pain-free and comfortable quality of life for as long as they possibly can until their last breath. And we realize that dying, much like living, is a part of just everyday normal life. So oftentimes we'll refer to the dying process much like the birthing process. And again, hospice isn't about dying. It's about truly providing people the care and the comfort that they need to live the fullest life possible. So we believe that hospice affirms life. It's neither hastening nor postponing death. We believe that hospice is living life to the fullest and allowing people to live with dignity and comfort. So again, what is hospice? Hospice is focusing on caring and not necessarily curing someone's illness or their disease process. It's really a quality model of compassionate care, and it places the emphasis on symptom control. The symptoms might be pain, they might be nausea, they might be shortness of breath, they might be emotional or spiritual distress, family grieving, whatever the symptom that is happening in this person or their family's life. We want to put an emphasis on palliating or bringing the symptoms under control and bringing the utmost comfort during this time of limited life expectancy. So just a little bit going back to the history of hospice, thankfully there have been good Samaritans and people who have cared for the sick, the dying, the ill for thousands and thousands of years. That is not a new concept, thankfully. In the biblical times and even before then, there was the concept of the Good Samaritan or whatever it might have been referred to in another culture. But in a modern sense, as modern technology ramped up through the early part of the 20th century, people stopped dying at home. They no longer were surrounded with family members at their last breath. They were sent off to the hospital, and tests and procedures and surgeries began to happen all the way up until the very last moment of a person's life. Well, there was a nurse in London after the World War who realized that all the pain and suffering that she saw just wasn't being met with the comfort and the dignity that she thought that these people needed. And so her name was Dame Cicely Saunders. And so she began in the mid to late 60s to formulate the hospice movement as we now know it today in the modern world. And so she gathered volunteers of doctors and nurses and clergy members in the community and social workers and put together what was called St. Christopher's House in London as the very first modern hospice movement. It was all volunteer-based, and she teamed up with the head of the nursing department at Yale University, and they brought the first hospice to America in the early 70s, and that was in Connecticut. And shortly after that, we're so fortunate that here in Colorado, numbers and numbers of hospices like Pikes Peak Hospice, Hospice of Northern Colorado, Denver Hospice, and others started to formulate shortly after that time as nonprofit, mission-based movements filled with volunteers just trying to love on and care for these people who were at the end of their life's journey. In the 1980s, President Ronald Reagan signed into law that anyone who has Medicare as a part of their health care coverage, as a part of their taxes that they've paid, can have access to hospice care. And from there it grew to include veterans benefits, commercial benefits like Blue Cross Blue Shield, Aetna, United, Kaiser, as well as Medicaid services. And hospices still do a lot of nonprofit work. Even if they're a for-profit company like Brookdale, we still provide as much as we can to the community to make sure that no one goes without these special hospice services. So as a volunteer, you might be asking yourself, well, I kind of understand hospice. It's this end of life. It's about people who are nearing the end of their life. And I get it's about comfort and compassion and all those things. But what are specifically some of the goals? Some of the goals of hospice include the self-determined closure to one's life, that they get to be put into the driver's seat, or their family member, whoever's making decisions for them, really they get to start steering the wheel again of the course that they want their care to be taken. And we want to help people experience a natural and a comfortable death in a safe and comfortable environment. And we want to be there for the families to help them through their grieving process as they anticipate their loved one's death and then long after the actual death. So where do we deliver hospice care? Isn't it just some building somewhere? No. Truly, hospice is a philosophy of care with a team of care providers going to wherever a person calls their home. And I've worked with folks who called their home underneath a bridge near downtown Denver. I've been to people's million-dollar mansions. I've been to people whose families and their lives have touched millions. And then I've been with people who didn't know a single soul. And we still brought hospice care to them wherever they called home. So wherever they live, whether it's a nursing facility, assisted living, senior care, high-rise, or just a modest home in the community, we are there for them. Some of the hospice principles that we want to highlight again is we want to treat symptoms in the least invasive manner. We want to focus on a team approach of multiple disciplines, multiple specialties, all coming together as one team to help this person. And again, we want to consider the family, or whoever the patient considers their family, as the primary unit of care. We want to look at this whole system in a team approach and understand what we can do to help them. And again, we want to put the emphasis on the quality of life, not the length of life, and we look at the whole person, as we've already mentioned. So how is hospice delivered? As I already mentioned, once a patient or a family member, primary caregiver, makes the decision to say, yes, indeed, we realize that our loved one or we realize that this person's life is nearing the end. They approximately have 6 months or left if the disease takes its natural course. And if that's the case and they choose not to pursue any further aggressive treatments, then they can sign up to receive hospice care. And the hospice staff then begins to make regular visits. Oftentimes they'll get 1 or 2 nursing visits a week, 2 or 3 CNA visits a week. A social worker and a chaplain will alternate visits. In Brookdale's case, we're so fortunate to have music therapists. I worked on hospices where they've had massage therapists. I've been a part of teams that have brought in special therapies like speech or dietitian therapy or language or occupational therapy. Whatever the case might be, we are there for them 24 hours a day, 7 days a week. But we don't move into their home. We don't set up a cot next to their bed and literally stay there all those 24 hours a day. But that's why we rely on the team of caregivers, of family members, of support staff to come alongside at this point to develop a plan of care that will meet their needs. This is a little hard to see, but I just want to highlight at the center of the circle is the patient. Their family and their friends are directly with them on the next level out from that inner circle. And then from there, our team of care providers, including volunteers, are a key part of this to provide companionship and support. Each care provider has a number of things that they can do to broaden this circle, to expand the care. You'll see it begins at any part in the circle. It might start with the medical director. Our team has a medical doctor who specializes in comfort care, specializes in end-of-life services, who consults with the family's primary physician to figure out what's the best course of treatment for this person. We have registered nurses. We have attending physicians that we consult with. We have social workers. We have home health aides, chaplains that aren't there to take the place of any particular spiritual or religious leader in a person's life, but are merely there to make sure that any spiritual or existential needs and concerns are addressed. Our social workers focus on family dynamics, focus on helping a family arrange for any outside resources that they might need, making sure that funeral arrangements are in place. The nurses are in constant communication with the doctors to make sure that the medication, that the equipment, that the supplies, that everything is in optimal working condition to bring the utmost comfort and quality to this person's life. And as volunteers, they're there to provide support and companionship prior to death, maybe even in the last moments leading up to a person's death. If they have a special skill like playing music, or if they have a special interest like model trains or therapy dog teams, or we even are looking to expand our care and our emphasis upon caring for veterans at the end of life. So we're constantly looking to bring veterans and folks that are from that kind of veteran culture onto our volunteer team to understand those specific needs and be able to especially recognize these special veterans at the end of life. Volunteers are integral. They're fully a part of our team. They're right alongside of everyone else, providing this goal of bringing the highest quality of life at the end of life's journey with compassion and respect. So where do you come in? Obviously, we think volunteers are pretty special at Brookdale. I love our team of volunteers. They're the most amazing people I ever have met. They come from all walks of life, have all sorts of different specialties, and they all have this heart that is so special. We call it the hospice heart. And if you feel like this hospice heart is inside of you and you want to share that with individuals in the community, you may not even necessarily feel like you want to sit at the bedside of a patient, but you have a heart for this mission. You can come on in and join our amazing office team, and they do so many projects behind the scenes to help support the care that we deliver to our patients and their families. We just want you to know that you're welcome to call us at any point in time if you want to look at volunteering and joining this amazing mission. Sometimes people ask us, well, isn't it sad or depressing to be around all these dying people? You know, being honest with you, it sure can. But hospice volunteers realize that there's a lot of joy and laughter and hope that comes with just the simple gift of presence that they get to bring to their patients, to family members, and to our office staff. And we're always there to support and talk at any point in time if there's any questions or any concerns. So what can I learn? There's a whole lot to learn, and it just begins with realizing that being with someone is oftentimes more important than doing something. Being there, listening is so crucial. We spend a lot of time focusing on how do we tune in and listen well, and how do we assist a person go along and review their life, look at their life story and find meaning and hope. Some of our volunteers run errands, others help in the office, others organize photographs and memories. Most importantly, it comes down to being you. You are the gift to our patients and our families. You are the gift to our hospice staff just by your communication, your eyes and ears, your visit notes, everything working together. So I really hope that you realize that volunteering with Brookdale Hospice can be one of the most rewarding things you could ever do with your precious time. Your talents, your gift, your heart can all play a big part in bringing the most joy and hope to a person's life as they reach the final journey home. Thank you again for considering Brookdale Hospice. If you have any questions or concerns, please feel free to reach out to me at any point in time. Thank you again.